Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. We are doing Unit 11 of Physiology. This is Chapter 55 and it's all about motor functions of spinal cord and cord reflexes. First of all, here is first topic. You have to read this topic for your concepts. Organization of spinal cord and organization of spinal cord for motor function is an important topic. It is important for your MCQs and SCQs. This anterior motor neuron and alpha motor neuron, these points are important for your MCQs, and these diagrams, these are very important for your SCQ. This gamma motor neurons and interneurons and anterior motor neurons, they can be your individual SCQs. So you have to do all of these organization of spinal cord along with these diagrams, and important points are highlighted which can be your MCQs. Then is the Renshon cell and their function. It is an important past question. This is an potential SCQ, so you have to do that topic. Next is the muscle sensory receptors. This topic is very important topic. You have to make your concepts quite clear in this, and all the highlighted text is important for your questions. This receptor function of muscle spindle is an important SCQ. You have to do this for paper along with this diagram. You have to draw this 15.4 figure. This is very important question, and it is also important for your MCQs. Next is the sensory innervation of the muscle spindle. This is all the detailed functions. Primary endings and secondary ending, they can be your MCQs, the comparison between them. Then is this SCQ, the dynamic and static responses of the muscle spindle. This is a very important SCQ. It is a past UQ, so you have to do this. Then this is important for your MCQ point. This is the continuation of that topic, the static response and then the dynamic response. This is a very important question. Then the control of intensity, it is important for your MCQ. Continuous discharge and a normal condition, it is also important topic. Next is the muscle stretch reflex. This is a very important SCQ, and this diagram is that along with that question you have to draw it and write a note. Next question is damping function of the dynamic and static stretch reflexes. This is also past SCQ, past UQ. You have to do this topic. Now is the role of the muscle spindle in voluntary motor activity. Next is the role of muscle spindle in the voluntary motor activity. It is also important topic and important points are highlighted. Next is the brain areas for the control of gamma motor system. It is also important points for your MCQs. Next is also important topic for MCQs. This clinical application of stretch reflex is also important topic. You have to make your concepts clear and memorize these points. Then is the Golgi tendon reflex. This is a past UQ and it is very important SCQ. You have to do this with this diagram. You have to draw this diagram in paper, and this topic also has quite important points for MCQs. This is the continuation of that tendon reflex and its function. This is also very important. It's inhibitory. This topic is also important for your SCQ. Then the flexor reflex and withdrawal reflexes, all reflexes and their pathways with the neuronal circuit. This is all very important. This is very important. Reciprocal inhibition and flexor reflexes, the neuronal mechanism of the reflexes, they are all very important topics. From here you have to do this MCQ. You have to do this diagram. Then is the cross extensor reflex. This is a very important SCQ. It is a past UQ. You have to do this question. Then is the reciprocal inhibition and reciprocal innervation. This is also important topic. You have to do it for MCQs. This topic, reflexes of posture and locomotion, is important for your SCQs and for vivas. You have to memorize all the reflexes of the cord. An important one are writing reflex, galloping reflex, scratch reflex, mass reflex. These are important ones. Then the spinal cord transaction and spinal shock is very important SCQ. You have to write a note on this topic in paper, and these are important points that you have to cover. That's all about chapter For more details in MCQ practice, do consult Medical Globe MCQ's Crack series. Stay tuned for more videos.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and subtly solved university questions, questions to ace your vivas, chapter pearls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and the MBBS cracks at your doorstep by placing your order at 0335 66 33007.